Even at the very beginning, when I first met her years back, she would come for visits with her father, and father would not say very much. She would be the one who knew what her condition was, what medication she needed to be on. I thought that she would be a perfect person who would have a relatively easy time transitioning from the pediatric world to the adult world, but things got complicated because of the health insurance.
I was taking medication. I was taking them for like 8-9 years, and I ended up running out of them. I couldn't get no refill because I didn't have no insurance, so I had just to stop taking them. I have no idea how expensive. I found out that the Remicade was like really expensive, and then that was just the medicine. Now, if you put it with the hospital and the assistant they were going to do for you and all the injections and everything, it's going to be more money. So pretty much, it was like really expensive.
Some of the medications that she luckily responds to cost on the order of $20,000 or $30,000 a year, and that is absolutely prohibitively expensive. The impact is tremendous because in Keyshla's instance, because of that, she has missed some appointments. She was not able to do some of the tests that would be also quite expensive if there's no health insurance coverage. And any delay in care because of that can make a disease more active and can be then more difficult to treat.
A lot of young adults who are healthy will go many years without insurance coverage. When you have a chronic illness, you can't do that because a 4-day hospitalization can be very, very expensive. And your medications are very expensive. So if you don't have insurance coverage and all of a sudden you land in the hospital, who's going to pay that bill?